Yeah. Now when you think of the pandemic, you think as if this was a horror film which happened somewhere. Or you saw a horror film. It's how we sort of uncoupled ourselves from those terrible times.
The following is a conversation with Dr Amir Burney, a doctor, educator, philanthropist and mentor. He trained in Karachi, Pakistan, specialising in orthopaedic surgery and sports and exercise medicine. He holds the position of co-director of Phase 2 studies at Sheffield Medical School. He's actively involved in several international charities such as DOGANE, Dow Graduates Association of Northern Europe, and is the founder of the Association of Pakistani Physicians of Northern Europe. I'm both humbled and excited for this conversation, as Dr. Burney has been a dear friend and guiding light through the obstacles and challenges I faced during my studies at Sheffield Medical School, particularly in navigating the additional challenges posed by the pandemic. To support our channel, please like and subscribe and check out our sponsors in the description. And now, dear friends, this is us getting a second opinion from Dr. Amir Burney. Hello, Mr. Burney.
Hello.
It's very nice to meet you, and thank you for joining us today.
Thank you for having me.
Here's how I'd like to start. So, do you actually remember the first time that we met?
I do actually.
You do?
I
Okay.
remember that you were the class representative.
Yes.
Whilst you were in third year, which is our Phase 2Bs. I think that's when I first met you.
All right.
But I knew of you through MedSoc and the things you were doing in MedSoc, and obviously then it led to more meetings at the committees and also through the work you were doing through medical school. I think you were president as well at one point.
Yes, I had.
So
Right.
I've got lots of memories of how and when I met you.
I've got a slightly earlier memory of you,
Come on then.
Mr. Burney. It's a good one. But the reason I'm saying it is I think my story would relate to a lot of other Sheffield Medical students and medical students. So the first time that we met was second year. You were or are the clinical skills lead at Sheffield Medical School. I turned up to my first session, and I think it was a communication skills session. And this was like the first or second week of second year medical school. And I arrived. We're in the atrium at the Sam Fox House at Northern General Hospital, and we're there. You arrived. You didn't give a speech or anything. You just arrived, and then you said, "Oh, hello, Haz. How are you?" And I said hello. And we had, I think it was a 30-second conversation. But afterwards, I thought, oh, Mr. Burney knew my name, and we've never met, never said hi. I don't think you gave me a first year lecture at that point, or I think we did some clinical skills. But the reason I say that is when I arrived at medical school, I was very nervous, very anxious, and you hear about, how seniors can be very intimidating for juniors. But for me, whilst I was a medical student, I didn't feel like it because you're only a second year. And then when you remember my name, it made me feel like Sheffield wasn't just a place of study. Sheffield was a home. And I think the story I'm saying resonates with a lot of people. And it's firstly perfectly fine that you don't remember that, because this is my story. It's not your story. And I'm sure you have your own stories where you met seniors and you remember that, oh, that person was very nice to me. But obviously you go on and you always meet lots of new medical students who are turning into medicine and going on to become doctors. So I thank you for that very nice first memory. And can I say, in my time at Sheffield MedSoc, of course the medical school isn't perfect, but I and I'm sure many others had a very good time, and the medical school staff were very nice and friendly. So I just wanted to share that, and I've been thinking about mentioning that to you, and I'm glad I actually said that. We had to put microphones in front of us. I wanted to talk about the culture in medicine. So in medical school, or the medical school staff at Sheffield, they're very nice and very welcoming, and I feel it's most of the time it's very easy to approach someone. But you do know, if we could maybe contextualize or talk about this, is there is this culture in clinical medicine where seniors are intimidating, very difficult to talk to. Maybe you're not friendly towards junior doctors and medical students. It's always intimidating talking to seniors, but why is it the case more so in medicine? I don't know if you agree on that statement, or what ways can we do to change it? Could you talk about that for us?
Yeah, and thank you. I think it's not just exclusive to medicine. Let's put it straight right up front. I think wherever you are, with this business, sports even, when you walk into a team or into a room of full of senior colleagues, there will be some degree of anxiety facing those seniors. Now, how those seniors come across, what's their, how they have developed skills of networking, talking to people, socializing, that does become more important than at the time. And junior doctors or junior students or junior players probably won't say much, or they are more on the receiving end in terms of let the seniors speak. And then when the seniors speak, they develop a impression of them, whether it's first impression or a lasting impression. And yes, I think it's across all professions, not just exclusive to medicine, where you can feel a bit daunted when you walk for the first time into an environment where you are not familiar with the people or with the environment itself. Medicine, yes, I think by virtue of who we are as medics, we tend to become very, very organized in our work ethics. That's how we work. There's always patient safety on our mind. There's always a degree of anxiety about our patients. And then to work alongside students or other healthcare staff or professionals, it's not easy at times. So sometimes that also brings out the personalities, or sometimes brings out maybe a few words here and there which might be misinterpreted or perceived wrongly or rightly by some medical students. So what I can say now, after having been on both sides of the divide as a medical student in the previous century and a trainee as well in the previous century or the last one, things have changed, and they have changed for the better. So I think things are much more friendlier. They can be very, very busy, which is another matter. But I think more and more so, colleagues, friends, consultants, junior doctors, they're a lot more engaging. That's the feedback I have picked up. That's what I've heard, seen at times as well. So things have definitely changed. I won't name names or say anything out loud about people, but certainly I've seen both people on extreme ends of being extremely, extremely sociable, welcoming as trainers, and then being very, very strict as well. Now, the strictness could have been misinterpreted as being, something else. So the discipline, as we said, what we might have faced, you may not have seen. We accepted it at the time. It was acceptable, absolutely fine. Maybe in this day and age, things have changed a bit.
Things have changed. I remember in final year, Dr Hughes, he mentioned this because he said in final year, that's when you maybe feel a little bit more part of the team. And he talked about this culture. He said, we are aware that it is there, that it is very challenging for juniors to speak to seniors, and maybe seniors can act in certain ways or, not be as friendly to junior doctors and med students. And he said, we do kind of address it. I think he mentioned in soft ways, and maybe that is the way to approach it. But he said a lot of it would only really change through cultural change and actually, juniors becoming seniors, because they realize from their own experiences and say, I don't want juniors to have what I had. But Dr said when he would speak to senior registrars and consultants, they recognize that they may act in certain ways, but then they find it very hard to change because they were taught like that, and they think that's how you teach that. And if you're tough and grueling, that's how you go through that process. I only mention it because you get the odd incidences, but still important to mention of, I think there was an incident at University Hospital, Birmingham, where a junior doctor had taken her life, and we've seen incidences like that, or people reporting concerns. So, whilst I understand this is a general problem, it's always tough for a junior to speak to a senior in any field. Why is it the case in medicine? What are the ways to approach it, to deal with it? I ask because you're very friendly and you're very approachable. But you are a senior. You went through orthopaedic training and you're a senior medical educator. Of course, your role is to help juniors all the time. Could you contextualize that, and why is that the case? What more can be done?
I think medicine, by the nature of what it is you can't really compare it to other professions. Okay. And when I talk to school, students,
how is it different?
When we talk to students in school who are looking or aspiring to be a medical student or to have a career in medicine, I always say to them that medicine is a lifestyle, and it's a life choice. It's not a job 9 to 5. It doesn't end at 5 o'clock, as you know.
Yeah.
So you don't go home thinking,
Yeah.
shutting doors, going home, but you always bring your patients with you. You know, we learn how to switch off, switch on. But the thing is, by the nature of what we do, you're looking after patients. There's, there's life or loss of life or loss of limb. The responsibilities, we all know what they are. So by looking at specifically at medicine, I think it's a high-pressured environment, because you are there to deliver, something for your patients to make them feel better or make them get better, whatever. And sometimes, unfortunately, it does not. And the pressures which come along are probably time restraints. How we are currently with the healthcare systems, we are inundated with increasing numbers or increasing demands, maybe lack of staff at times. So those pressures build up. The other thing, talking individually, which you did, I think our life experiences shape us, shape our personalities. So when I walked into medical school, I was an entirely different individual, let's put it this way. Even when I graduated, I was quite different to what I am today. And then I met some brilliant trainers, some great people along the way, and some not so great people along the way. Some people who were extremely skillful, but maybe not great personalities, as friendly as we thought they should be. But they were fantastically skilled people. So you learn the skill from them. And that's where role modeling comes in. I think you shape your life, your personalities, as you go along your career path, you role model, whether it's insensible or actual real-time role modeling. It's important that we do factor in how we role model and who we meet along the way in our career paths. And very early in my career path, I decided that I will be part of a teaching faculty. I will always strive to teach medical students what I could do at the time, whether I was a junior doctor or as a trainee in orthopedics or as trainee in general surgery, and also to be friendly. So I always said to my medical students, I don't know if I ever said it to you, that I'm friendly but not your friend. So while I'm at the medical school, my duty of care lies with you, but I'm more professionally bound with the medical school and the roles and responsibilities that come with it. So I'll be friendly till you graduate, then I can become your friend, things like those. So
like now we're
friends,
together.
and we are. And there's always a flurry of, with social media, with the advent of social media, people will try and contact you on Facebook or Insta or whatever. And there's a flurry of Facebook requests on the day the class graduates. So you remember
in July on graduation day.
July of the year, there's always like 6, 7, 10, maybe more people saying, remember Amir, you said. I say, yeah, once you graduate, maybe. So I think the distinction lies between being friendly and being friends, maintaining professional boundaries and relationships, and also, how I shaped myself to come across as a more friendly and more approachable person, because I learned it from people.
Can we talk about then how do you shape yourself as a role model? Because I'm sure registrars and consultants will be listening to this. So do you remember every medical student's name, or how do you go about making that effort to create that friendly, nice environment like you had done for me in second year? Do you remember everyone's names? Or
I think that was my party trick, wasn't it? To try and remember as many, especially when we started. When I started some years ago, the class was only about 230 odd students. So it wasn't that difficult. Now we're looking at 360 plus or even more. But this is the trick I learned from one of my friends who's not in medicine, who is in the banking world. And he taught me many, many years ago how to remember names and how to remember team members' names, because it really helps. It breaks the barrier so quick. So if you work on workflows like yourself has, and if you know the nurses' names or your operating team members' name, the ODPs, for example, it just breaks barriers by knowing their first names. Like you just mentioned earlier, I must have said, Has, how are you? And that's one barrier gone out of the way. So you remember me, you know me, coming from a senior. So I learned it, and the trick was to make an association with it. So in your case, I would remember Has with a long black hair, and that would have been my little point to remember somebody's name. So I've done it with many people across, not just medicine but also outside medicine. So just a little association, and that helps you to remember names. But it's a real good skill to have. It helps when you remember names, just the first name, and it helps.
But it does help make it easier for a junior to
for a junior, even a senior. You walk in as a senior and you know the team very quickly and you get to know them by names. It just breaks that first initial barrier of, here's somebody who's senior, but he's giving me respect maybe, or recognizing me maybe by remembering what my first name is.
Could you speak honestly, how do seniors see juniors? I'm interested to hear. I want to ask from the medical student perspective, but on the senior perspective, how do they see their juniors, their medical students, junior doctors, maybe even a registrar? Positive, negative, what role do they play? How much I need them, use them? How does a senior see a junior?
Well, it depends on which level of experience the junior is. For example, first year medical students are looked at first year medical students. So here they are, fresh into medical school or university, and obviously they are looking to be taught a lot of things. So it's more of a one-way, unidirectional giving of knowledge or teaching of skills, for example. But as you progress, if I had a final year student working with me, I know they are about to graduate. They will be the next professional working in the NHS, for example. So there's a lot more dependence. I can actually depend on you to maybe take a history or physical examination, because you're giving me that confidence to depend on you. So if I look at you professionally, I will see the progression curve from first year to, let's say, final year, and then beyond, as from a junior doctor to being a senior doctor. But certainly I also see students developing their own personal not personal experiences, but developing their own personalities. So for example, I know how, I can say safely now, I can see a real shift in how you guys, when you come to maybe third or fourth years, you're now thinking more of the job than actually the exam.
Isn't
it?
True.
So first year everybody's thinking about the exam at the end of the year. Second year is the same. Third year,
how to revise.
To revise. Will I pass or fail the exam? And fourth years and final years, when they ask me about the exams, I say, well, forget the exam for a bit. Are you good enough for August of that year, working alone in a difficult situation? Will you be able to do this? And most of them say, yeah, I'll be fine. I said, that's your exam, because exam is just a little hurdle left for you to just get over with. The real test is now in the real world when you start doing your job. So I see a real shift when you're third, fourth year. So I see students from many different angles, not just professionally, but also how their personalities develop. Same with junior colleagues. And I've always said to students, including yourself, that I'm a colleague, I'm a senior colleague, that by virtue of being born before you, having many years before you, but we are colleagues all the way through. And that probably has changed, where previously when I was a student, maybe the approachability wasn't as much, or the perception that you can't approach people. And I tell you what, we thought we couldn't approach somebody. The moment you did, they were fantastic. It was just the aura, the fact that no, you can't go and see Mr. So-and-so because of whatever reason. It was never the case. It was just us being worried or being scared, or what if I said the wrong thing?
Yeah. Can you talk about how should a medical student, how should a junior doctor then see a senior now? Because I still experience it. I'm working at University Hospital North Midlands in general surgery, and registrars and consultants are very intimidating with their superiority in surgical knowledge, even medical knowledge. How should we approach going into that scenario? And then also, I do want to ask, even if it's a challenging environment, maybe a challenging relationship, how should a junior manage that? You talk about the perspective from a senior, which is respect. How does it work the other way?
I think it works both ways. I think respect is key. Appreciation of somebody's experience and expertise is key as well. So when you as well, or when I was a junior doctor, if I saw somebody who was very skillful, that probably was my little benchmark to see, all right, this particular doctor is extremely skillful. They are definitely going to teach me something which I will require for the rest of my life. So for me, it's about the skills and also their professional behavior. So the moment they started to talk, or how they were interacting with, let's say, patients, colleagues, junior and seniors, for me that is how I saw my seniors, and that's where I started to sort of mirror imprint their behavior. And something interesting I'll tell you, what you would not realize right now is that you probably pick up bad habits along the way by mirror copying people. Then you become those people, and you always saw, I will never become this person or that person. And it's amazing how many times I've seen that happening. So it's a real conscious effort to learn the good habits or the good skills from someone and not try and pick up
the bad.
I say bad very, very safely. Something which is not your personality.
Fine.
Fine. We've all seen and heard things. When you work in a clinic environment, I would never do some things because of a very conscious effort. It's very easy to say things out loud when you're worried or angry.
Because it matches you.
Yeah.
But then maybe I may see it as bad or not ideal, but then I'm going to say, cut slack for the senior in a way, and that this is a learning experience. Not everyone's perfect, and this is part of me learning and watching, maybe dealing with a challenging environment, but I'll take on what I think is good for me.
I think repetitions also precede us as seniors. When as a junior you walk into a clinical area, we're talking medicine now. Repetitions do precede. So if you know somebody, they are very harsh, or they're very strict, or they are total disciplinarian, and be very careful, and suddenly you are being, and you never really tried on your own as to build a relationship with that senior. What seniors love is, what I would have loved is punctuality and respect. So another trick I learned or was taught was to turn a minute before your consultant and leave a minute after. So they felt you were there all the time. So when they walked in, all this just a minute before they've come in, you were there, and when they left, you were there. Now, how many times have you seen people not turning up? I'm talking openly, candidly, or leaving earlier, or leaving theaters when people are still operating, and you think, all right, fine, fair enough. I won't stop you. I can't stop you. But if you had stayed on, it would have created a different impression of you. But again, going back to the times when we were trainees, you wouldn't leave. You'll just be, as long as the surgeons are operating, you are still there. But yes, medical students had to leave at a certain time, but trainees would hang on till the operation was finished.
I've noticed my ward that I'm on, there is the respect that if I'm meant to finish at a certain time, even the seniors, they try and make you leave at that time as well. As long as you're engaged from that. For me, it's 8 to 4 shifts is mostly my shifts. But I see what you mean. If you're engaged, respectful, that can help. And even though it may not be a perfect day, but you're still learning from it, and not everything is perfect or perfect environments. No, I do see that now. Okay.
My mother was a surgeon and a gynecologist, and she was my first trainer in a way. So she gave me a lot of insight into how to work with people, and we had a hospital in Karachi, Pakistan at the time. So from my 4th year, I was managing quite a lot of stuff there as a 4th year medical student, because it was our family business in a way. And my mum obviously saw me running it after she retired or gave it up. And that's where I learned how to manage people, or people's skills came in from very, very early, and also respect for nurses, for colleagues, for other staff around. And that was key to my development as a personality. So I would never ever disrespect anybody. So if I'm angry, I go quiet. And as Professor Nigel Beck's once famously said to me, that I've learned to express anger like an Englishman, with a smile and gritted teeth. And I said, okay, fine. And,
keep it to yourself.
And lower your voice. So that's what it is. So in Pakistan, I had a little trick where if I was extremely angry, I would start to speak in English. And my boss at the time, Professor Sumro, bless him, he's no more with us, would say, oh yes, he's not getting angry, so Amir is talking in English, means he's very, very angry. Because when you talk in your languages, which was Urdu at the time, you can slip. Yes. When you're emotionally charged up, you might just
become very formalized when you speak English.
English is a conscious way of choice of words. So when you were at a meeting where you weren't very happy, or with colleagues you weren't very happy, I switched to English. Right. The problem was England, because you can't switch to.
No, it's the only language.
Even more careful in English, and you know how things are sometimes.
Yes.
Yeah.
Okay, no, that's interesting to know. Can we talk broader? So you are a medical educator by background, by profession. What is medical education?
Right. So as I said, my interest began when I was a trainee in general surgery many, many years ago. In fact, as a medical student as well. So I was very keen to teach the junior medical students. But I did not get much opportunities as a junior medical student to teach colleagues. I trained in Pakistan. So I was a student at Dow Medical College at the time, now known as Dow University Health Sciences, one of the second largest premier institutions in Pakistan, and I'll always be forever grateful to our trainers and the college itself. We literally studied for nothing. We hardly paid anything into the system, and the experiences we got there, the training, the level of, it's just phenomenal. So, and here we are because of it. But I didn't think I got much opportunities as a medical student to teach. I was always interested in, I was more into sports and other activities. So maybe that took a slight backseat. But then once I became a junior doctor, I was very interested in teaching. One, for the reason of that, another senior said, if you want to pass your exams, start to teach. So the moment you postgraduate exams, whether it's the FRCS, MRCP, whatever, start to teach, and also start to teach outside your comfort zone. So I was a surgeon in training, but I started to teach medical emergencies like management of asthma in a surgical patient, or looking at ECGs, or teaching ECGs to junior students. And they were real uncomfortable zones for me as a surgical trainer.
I think they're uncomfortable zones for many
surgeons
talking about medicine.
If you go into orthopedics but thing is that they will come up in exams, and also gives you confidence when you are outside your comfort zone and doing anything, not just teaching. So for me, it was always there. Whilst I was here, in fact, I was in Nottingham, so I did something called a surgical fellow in medical education. It's an 18-month rotation they do in Nottingham. And I was very interested in learning how medical education works in this country. How do you become part of faculty? Who runs exams? How is the medical school connected with the trust hospitals? And my consultant at the time told me about this particular post, and said, go for it, And also they paid for my master's in medical education. So while I did the 18-month rotation, I learned about blueprinting, curriculum design, all of that which happens behind closed doors, setting up assessments, but also went through the process of doing a master's in med ed. So that sort of cemented my belief even further that, this is what I want. And although I was just still working as a surgeon for a very long time, and then unfortunately had a knee injury, which lasted for 4 years. And that was a little trigger for me to start to think, what will I be doing the next 5 to 10 years? And I was always very much keen in medical education.
Where were you at in this?
So I was in Sheffield. This is 2010. So I had finished my training. I came from Pakistan, finished all my training. I was working, and I was already working in Sheffield at the time. So I was working in the Department of Medical Education as a practice-based clinical skills tutor. If I remember correct, that was my first job here. So and Nigel Becks, I met him and he interviewed me, and then I started working in Sheffield. But immediately within the month I slipped in that year, December, I slipped on snow and did my knee. And then 4 years later, I was still working in Sheffield, but I was looking at more and more what will happen next in my 5 to 10 years work career. And somebody outside medicine has always been my mentor. I would always ask him the questions, what do you think? Because they give you a very non-prejudiced non-medical advice about life, not from a doctor's perspective. So I was to ask my mom, for example, or a senior colleague in medicine, they will have their medicine glasses on and look at, and this friend of mine will always look much more laterally. And we decided, med ed is the way to go forwards, make it more formal, more structured, learn more. So I started to learn a lot more. So Professor Nigel Becks, for example, I observed him in action. Michelle Marshall here as well. And so many other names I can think of. So I went from role modeling in surgery as a surgical trainee to looking at role
mentoring
models.
kind of role in a way.
So they were mentoring me, and I was role modeling myself, learning the lingo as well, behavior. And I saw how Nigel was so friendly with everybody. Nigel Becks, you may not have
he's at Doncaster.
Nigel Becks, Professor Nigel Becks is retired. He was the head of medical education at the time. Right. So he is somebody I look up to because he taught me a lot of things, and so on and so forth. But Michelle Marshall after, and then so many other, Julian Burton is still. So you learn a lot of these things from people, and I think it's important that you do for you to become successful later. So med ed for me became more and more a career path as we went along, and also not just teaching but also managing education.
So that's what I wanted to ask. What is medical education? Because I feel, even my experience, I know I was on MedSoc president, I was on curriculum management committee meetings, but still I feel most of what people and my colleagues in my level, it's more just teaching on different topics, maybe designing larger national teaching programs. So what is medical education? Could you explain what is actually that next step, about maybe your role at the med school, or could you just talk a bit broadly about how it works, basically?
So it starts with your interest in teaching, no doubt. So it takes a certain type of person saying, I would like to be part of a teaching faculty or be part of a medical school where I'm involved in delivery of teaching. And then it leads to other things, for example, like you mentioned, curriculum design or assessments designing, and so on and so forth. And then you want to be an examiner, so which is fine. So you need to learn how to become an examiner. So there's a training element to it. So not everybody can teach, or not everybody can be an examiner unless they have the required training. And then there's the management of it. So which is where I am now. So where you are not just delivering or teaching per se in a classroom or in a clinic or in a lecture theatre, but you are looking at the overall delivery and the quality of education. One. Secondly, you're also looking after your students, the duty of care I mentioned earlier. So you are technically responsible for the medical students who are at Sheffield in this case. And then also developing them professionally. So making sure that your students are being looked after, the curriculum is working well for them, and also that you are there to help or step in when something goes wrong, for example.
Right.
So support. There's a lot of support at Sheffield Medical School. Many other schools have their own support programs. So our job is not just teaching now, it's also management of teaching. Right. It's support for our medical students and stepping in when things go wrong.
When you say management of teaching, is that designing the curriculum? Is that figuring out what is actually being taught or what is in the exams? Is that monitoring the lecturers who teach the phase 1, phase 2s, or the small group teaching sessions we do in third year and onwards? What does that involve?
Yeah, so curriculum design,
what do these terms mean?
So curriculum design, obviously we have this content which we have to deliver, right? So
that is not decided by you in Sheffield, it's decided by
the GMC, the
GMC.
Department of Health. So it's very loosely directed. So it's up to each individual medical school how they deliver the content and what assessments they have at the end of it. But certainly there is a common content across all medical schools. And then we choose how to deliver it, whether it's going to be PBL or small group learning, lectures, clinical, etc. But the commonality is clinical placements, which are the same everywhere. How long they are, 6 weeks or 12 weeks, that's down to individual medical schools, but they are very, very commonly structured or similarly structured. Now, management of medical education entails, one, the design of the curriculum itself, quality assurance of the curriculum. Is it actually doing what it's supposed to do? Designing assessments and then quality assuring assessments, and then also providing all the support structure around those things, which is provided by our professional services team members. You study in Sheffield, so there are professional services people who support each individual phase. For example, phase are the years we have, and also then stepping in when people are in trouble, students getting into trouble, for example, or providing the right kind of support. So medical education now includes a lot of little bits or components. It's not just teaching, it's also teaching, it's also designing, it's also support, and it's also quality assurance and so on.
We were talking about this earlier. I feel medical education is very professionalized, and even more is taken on for a medical educator. So I've also done a master's in stem cells and regenerative medicine. I did it here in Sheffield at the biomedical science departments. It was a really educational time for me. Professor Angel Bariki, she was lovely, and taught the content very well, and also those professors taught it very well. Maybe it's my misunderstanding, but I feel maybe in other departments, not at Sheffield, but just everywhere, is it's if a lecturer had an interest in teaching, then they would teach, or they had an interest in designing a course, then they would. Whereas, like, for example, you're a full-time medical educator, you don't do any clinical work, but then, and I think most of the med school staff here do that, and I think it's a similar structure. Am I correct saying it's very professionalized medical education compared to other education and other university departments? Maybe, I don't know.
Maybe, because I can't really comment because I don't have the insight. I haven't seen the other departments work. My answer would be it should be the same level of professionalism. So I can only talk about obviously medicine and how we work as medical schools and medical education per se. What I can compare it to is my experience of previous years when I was sort of one as a medical student and secondly as a junior doctor, and what I saw. So what I think now, it's very much structured. It's quite formal. It's structured. There's a lot of support in the system as well. Things are much robust when it comes to quality assurances, whether it's the content of the curriculum or the assessment itself. And then obviously you are responsible to give answers back to the GMC when they come for their 5-yearly visits or 2-yearly visits. So there's a lot of questions asked at our end as well in terms of what's the quality, is there equity and equality amongst students about what's being delivered. We have students going to, let's say, distant district general hospitals and are also working in the main cities. Are they getting similar levels of training, and if not, then why not, and how do we make it better?
Right. I was reading, as I love reading, is the GMC guidelines. So people who are listening, the GMC is the General Medical Council. They set the standards for doctors to meet. And so you love teaching, you love medical education, but even for those who are not as interested, it still is in our principles to teach. So quotations from it, you go to Good Medical Practice, point 39. It says, you should be prepared to contribute to teaching and training doctors and students. And point 42, you should be willing to take on a mentoring role for more junior doctors and other healthcare professionals. So, and I find that very interesting, that even if you have no interest in teaching or not as much interest, and you don't want to professionalize it or get extra qualifications, you still have to. And we all say the Hippocratic Oath at graduation. We've all signed on to this. So why is that a core principle that's needed for every junior doctor? Why this? Maybe not as much interest as you, but why does every junior doctor have to have these principles?
I think yeah, you're right, actually, because
it's interesting.
It's interesting, and it makes you think how was medicine taught. So sort of it went before it became really institutionalized, and large institutions, medical schools, universities, maybe it was taught differently, going back all the way back many years ago. If I remember correctly, the word doctor comes from docere, which means to teach in Latin.
Oh, really?
But correct me if I'm wrong on that. It's just, I'm just thinking where the responsibility to teach comes in. But then you look at the apprentice model, somebody goes and works with someone and they start learning as an apprentice. And obviously now we are working to different models nowadays. But I think it's our duty to teach as senior doctors. It's a duty to teach because you are teaching the next generation. And I go back to medicine as being a profession where there's a lot more responsibility in terms of when you are looking at who is at the other end, when you are providing a service. When I go to students who are in schools and they want to become a medical student and then become a medic, I always say to them, as I said earlier, this is a life choice, lifestyle. The only other things you can compare it to is probably airline pilots and soldiers in the army. Yeah. Because there's no rest, and there are vigorous hours, there's long hours, responsibilities. If something goes wrong, there will be somebody at the end who might come to harm, for example. So those are the only 3 professions I always mention in the same breath. Army, you can always say hotel industries and things because they work night time. So look at how we work through the nights, for example. We do it as students, we do it as medics, and it's quite exclusive to these 4 professions. Not many other professions do it. They might work late hours, but no other profession, you work from 8 o'clock in the evening to 8 in the morning, 12 hours straight, and sometimes without adequate breaks, rest, water, food. You're a junior doctor, you know what I'm talking about. Sometimes people don't even get toilet breaks, which is not right, but we do it. It's the nature of the job we are. So it's a lifestyle choice. But having said that, I think all of us, or most of us, should have time to teach, to train, because that's it's the GMC's guidelines, obviously, but it's also our internal or inner guidelines that I've done my bit. I've learned a skill. I think I should teach it to the next person who's interested in learning it. So the cycle goes on.
Right. No, that's interesting. I think we've talked very eloquently about medical education, and whilst it is a science, of course, teaching someone about the subject, what you need to learn in neurology and gynecology and other specialties, but there is an artistry to it as well. How do you feel, you as a medical educator, how do you feel that you're expressing yourself, that you're living your life, or you're contributing? How can you explain like the artistry of medical education, or how do you feel you're expressing yourself?
That's a good question, actually, because that is a skill I developed, where you face an audience, whether you're facing 5 people, 2 people, or 4,000 or 5,000 people. Now it doesn't matter to me, but at the time, you're deathly scared just to walk into a lecture theater full of 300 students, and your professor said, Amir, go and deliver a lecture. And they gave you their slides, which you had not seen before. And they said half an hour before, I can't make the lecture, can you go do it? These are real experiences. I'm back in Pakistan, a couple of times it happened to me. And I said, yes, okay, I'll go deliver it, but I have to read through the materials.
Exactly. To teach someone is different.
You teach, because nowadays students are very, very perceptive. They're very sharp. They'll pick on lack of confidence very quickly, lack of preparedness very quickly. And they, and they will not hold back with all this feedback coming through. So I think what you need, one is the interest to teach, which is fine, we all have it. I would love teaching, but can you actually do it? And can you do it to a level where
it's comfortable and you enjoy it?
It's like your second nature.
So then how have you got
so how did we get there? So I think you need certain type of personalities, but I by nature I was an extrovert, always was, sports and music and so on. So I was quite used to an audience. I thrived on positive feedback from an audience, engaging, playing. That gave me the confidence to do what I wanted to. But as I said earlier, when I started to teach outside my comfort zones, I think maybe anecdotal stuff. Once many years ago, I was in a clinic somewhere, and they called me, said there's a teaching session at lunchtime, and I said fine, I'll do it. And I was orthopedic trainee at the time in Pakistan, and I did not even ask what is the topic. I just presumed it's orthopedics or surgery. And then half an hour later, I said, called back and said, where is it? And who am I teaching? And what am I teaching? And they said, third year medical students, and it's ECGs.
Oh, no.
Because somebody else couldn't do it. So we asked you, because you're very interested in teaching. I said, what are you doing here? I'm in orthopedics. What are ECGs? So for the next 10 minutes, I just shut door and just went through, that book, ECG Made Easy. I was trying to find it online. And it wasn't working. I said, this is going to be a huge disappointment for everybody, including myself. I shut everything off after the clinic, went upstairs. There were 5 or 6 medical students sat there with pen and paper out, ready. I said, okay, fine. My name is this. Who are you? Blah, blah, blah.
Was there slides as well?
There was no slides, because I just said I will. Okay. So I said, okay, have you ever done an ECG? So yeah, I could do basic ECGs and the basic rhythms, rate, rhythm, old Q waves, things like those. So let's go and do ECGs on the wards. So what I did was flip it to let's do ECGs rather than teach you through ECGs. That you can go back and read what we discussed or talked about. Here's some resources. But that confidence came because of the fact that I learned it from somewhere, and how to be confident to face off. But I never did it again, because I would always ask, who am I teaching, where am I teaching, what am I teaching, and how do I know they've learned it? So the 4 things I learned immediately as a medical educator. Many years, I wasn't even a medical educator, I was just a junior doctor training to be a surgeon at the time, but I learned it by reading some resources.
Did you feel like you had a responsibility to teach them properly, teach them effectively, so they can?
Because that could have gone down the drain very quickly. My whole street cred as a junior doctor who's very keen to teach would have gone down. It was going down till I walked into that room, and from somewhere I realized, let's do ECGs, because who's taught them how to do an ECG? They had never done one. So they're putting on, the electrodes and talking to patients, consenting. And they loved that session. And thankfully I was saved. And never again did I did that, because I was always going to be prepared. So what people pick up is lack of preparedness. Students will pick, you've been there, probably you'll agree with me that somebody doesn't want to teach, not keen, really, not really coming across as being confident. Students pick on it, and then students can be like sharks at that time. They can really rip you apart with their feedback.
So then how do you feel now? what do you love about teaching, or what do you love about curriculum management? Can you talk about that?
I've picked up a real good skill, over the last 10, 15 years working in medical education. Something I might not have thought I would have ended up doing maybe 20 years ago. But I've learned how to manage curriculums. I've learned how to work with teams, work with students and junior doctors and senior colleagues across so many trusts, both here and abroad. So it's really expanded my horizons of working with people and working with different types of people. And also my own knowledge of medical education, because yes, I did the master's, but a master's work, you work from module to module. But funnily enough, I was sat in one of these training classes, and they were giving names to all of these techniques, and I kept saying to myself, what, I use that. I did not know there was a name to it, or somebody invented this in med ed, for example. But there's something we do it, so we learned it from somewhere. Now I had names to those techniques, and I use them all the time. I must have used them with you guys as well. How to flip difficult situations in teaching and make them look as if I'm still in charge, although I might still be weak in terms of knowledge, but it never came across. So how do you rephrase, how do you regroup, how do you redirect the students?
I appreciate you sharing those stories and also being open about it. The reason I've asked about your interest in medical education is, firstly, there will be medics here who do or don't have an interest, who would just want to know more about how you develop that, because in medicine many people change their specialties or interests, and just learning about your story, and also just learning that you actually found it challenging, even though you had an interest in it, but even your early experiences weren't fantastic experiences, but then you grew to then eventually love it. And I feel a lot of the time we go through our 9-to-5 job, but then we kind of forget to take a step back and actually think, are we actually enjoying this? And if we are or not. So it's very nice to hear that. And of course, maybe every day you turn up at the med school and you're just going through the motions. But it's nice that we've had the time to reflect, to hear your interest or hear your love. And then hopefully, someone who is listening to this can find a love for their own thing, or what does love in your job mean? So that's very nice. I wanted to move on to the pandemic. So that was 2-3 years ago. May 2019, I think, is when it started. Well, that was the first lockdown. February, yes, that's when it was. And lots of industries had changed at that time. Education had changed at that time. Could you just talk through the process about what happened for medical students, how their training had changed during that, I guess, few months of lockdowns that we had?
Yeah, now when you think of the pandemic, you think as if this was a horror film which happened somewhere. You saw a horror film, it's how we sort of uncoupled ourselves from those terrible times. But they were terrible times to begin with, and they became, I think, for 2 years we were in a situation where there was a pandemic ongoing, and it affected us all, professionally, personally, including our medical students. And not just medical students, but all students across the UK, I suppose. And it was a really difficult time. When you start thinking what happened, I still remember 17th of March was the last day I came here. At 17th of March 2020, we were here. We went home, and something was happening. We were hearing stories that something is going wrong. This virus is out. And then on 23rd of March, I think we went into lockdown. That year. I remember that, and it was scary. It was like, what's happening here? We had nothing to fall back upon. There was no reference. There was no experience of previous pandemics. So everything was new to us. What we learned as a medical education group working in Sheffield, that we had to adapt very quickly. We had to rethink strategies, invent innovative ways of delivering education, and also assessments. And I think what I've loved about Sheffield is, again, I'm talking about Sheffield because I worked here, is how quickly the teams come together, how quickly we have found solutions to problems at times. You probably as a student would not know this, but as a team, we've really worked very hard, not just during the pandemic, but other times as well. And we come together. There's no blame culture within the team. It's always, yes, something is going wrong, let's sort it. So we learned how to do hybrid teaching or online delivery of medical education, which, is quite absurd to think of that you're delivering medical education or medicine online, because the whole work system belongs in the clinical environment. That's where you learn stuff. So how do we get senior medical students in? And if you remember those that year, the medical students were graduated very quickly, the final years, and they became interim foundation doctors, and they were brilliant on the wards. And you did a lot of work, if I remember, volunteering people into the pandemic and working as students, and obviously it got recognized by the British government as well, and Her Majesty at the time. So we all did our bit in a way, but we had no experience of doing what we did. So I had to learn how online working works. So I literally had to sit down and work with people who are not medics. So how does it all work, and what do I do online? How can I do it best for my particular year? I was looking after second and third years at the time. Delivery of quality medical education via online systems like Zoom and other platforms. Google Meets came later. I think we were using Zoom, and then obviously our own.
Then you had Google Hangout, Blackboard, online sessions for lectures and small groups.
So it was a big learning curve for us. So, but as a student, they would not see that learning curve. They expected us to just switch
that's
off
what I wanted to talk about.
And just deliver the stuff, because I'm not going to a clinic, or I can't be in a lecture theatre. What's happening to me, my medical education? And fair enough, it was all for them. But we were learning behind the scenes very quickly, adapting as well, and then delivering. And I think we did a pretty decent job of it. And then we also had to factor in the risks to us, to the medical students. I know we couldn't come into medical universities at the time. They were all locked down, but people were going on to clinics, for example, and who goes and who doesn't go. At what point do medical students go? And I think initially that year, I think there's hardly any clinical placements. But then the following year there were, with all the precautions put into place. So what we learned as medical educators was to adapt, pick up technologies we might not have picked up till 5-10 years later. I don't think online education would have come into medicine,
not as advanced,
unless we had that pandemic. So the pandemic sort of became a driver to learn more things, and we learned to work through cameras, working with colleagues. All these meetings were happening online, for example, and it was a whole new. And then work from home became a new culture for most of us, and even for quite a few of our medical friends. They were working from home a couple of days, and then going to the clinics on a couple of days, and working from home. It's a whole new culture. And then try to be safe and during the pandemic as well, and not get unwell. Most of us did get very unwell at times. So I think now it seems a blur. It seems like a real blur to me.
How did you feel during that period, that initial period of switching to online, then switching back to somewhat in person, dealing with those challenges of maybe staff members becoming unwell, and then you're not at 100% capacity, you dealing with those challenges, commuting? Can you talk about those challenges that you and the medical school staff had faced? How did you feel in that moment?
Yeah, it was, initially we were, I think I was absorbing the whole impact of the pandemic, not knowing what it would lead to. We never knew it was going to lead to so many deaths and such huge issues, but it did. But once you got to know that yes, these are serious, this is a serious lockdown, nothing is moving in terms of people moving from one place to the other, everything has to be delivered statically from one side. We learned, as I said earlier, the techniques to do it. How did I feel about it? I was, you're scared also as well, because you're exposed and you're worried about your own self or your family members, and you had to keep sort of block that out as well, because end of the day you're also doing a job professionally. So you had to sort of switch off. You have to block it out. So as doctors, we keep saying we can switch on, switch off. But in the pandemic, it became quite difficult to switch on, switch off, because it was quite personal at the time.
Well, that extra burden,
isn't it? It's a huge burden. And then also, then you read the media, you look at television, and then suddenly it's all doom and gloom. But I think for the initial 6 months, we were experimenting a lot with what needs to be done for our students and how it needs to be done. Then we got better with it. We learned. And then the second year, I think, of the pandemic, we were actually delivering pretty decent quality medical education, hybrid. So online/clinical placements, or online/on-site, with all those precautions in the middle, for example. We had to have an OSCE in 2021 with all the precautions, with people wearing masks, and patients and students and everybody else wearing masks. And just to wear a mask and then try communicating with someone, it's difficult. We can't see the whole face. How do you know what they are saying?
Did you find it challenging, maybe how medical students or other people would, I'm going to say, target you or say things to you, or there was this general anger which no one really know who to point it to? And whilst, let's say, of course, you would point it to the governments, but then people would look at their own workplaces and maybe target towards the med school. How did you feel or cope with that additional challenge for those few months?
As a team, yes, we had issues. Teams, things did go wrong, and because it was a very, very difficult time, and these are unprecedented, no previous experience of anything, and people were reacting to rather responding at times, and my empathy was with medical students, because here's somebody who's gone into university at 17, 18, 19, and down they're shut out of university for 2 or 3 years, not knowing what's happening next. But those are the really formative years. This is where you grow up and enjoy life, and for somebody not to have it can be a real frustrating time. So that's all. I looked at my own kids, for example, who were two of them were at medical school. One was at medical school, one was at university doing something else. But you could just see how frustrating it was for them, for young people to be cooped up, not being able to go out and learning in isolation. That's not how life works. You learn together, or you work together, you succeed or fail together. And that made a huge impact on people. And I saw, a lot of negative sides coming out from people, the bad side of certain people coming through. And I'm talking friends as well, colleagues as well. It was just the pressure of the times and whatever it was. But there were some serious comments coming through from people, generally. But our job was to counter them. Our job was to absorb them, not react, respond to them. If somebody made a mistake, so what, it happens. Let's try and rectify it. So we did very well. Now I can say it as a team. Maybe somebody might differ from what I'm about to say, but what I saw was a real good team working together in the pandemic in med school, and do the best they could under those circumstances.
So that's, I think that year, in the first few days, I was elected MedSoc president, and I can say that from my interactions with the med school, they did work their hardest. Working with you, I think I spent most of my time with Professor Deborah Miracle-Eaton, Professor Michelle Marshall, and Fran Oldell. Most of my interactions with them, and firstly, they interacted with MedSoc very well. Not just me, but welfare reps, phase reps, even our social reps as well, to make sure that we're meeting the social needs of students. They engage at every stage, and whenever decisions were made about moving online and then doing hybrid, it was always in consult with MedSoc, and MedSoc tried our best to engage with students to make sure we're serving them. I found it challenging, of course, because I'm the voice, MedSoc with the voice between med students and the med school, and I'm dealing, with anywhere from the dean of the med school, Debbie, all the way to medical students and even their parents. Like, I remember one parent saying to me, I'm very concerned that my son is an international student living in another country and now dealing with this pandemic. So I on a personal level, I found it very challenging, monitoring that breadth of responsibility. But as you said, I think the med school did a pretty good job through those, let's say, 6 to 8 months of that, lots of change going on, and having those conversations. And there were the odd incidences where someone would overly have a go at the med school, and whether it's rational or not. But then, as you said, you're dealing with emotions at that point. And I think it was a challenging, but whilst we're talking, doom and gloom, but actually a lot of students have gone on to progress. Now some of them are graduated, in my years, F1s, and some of them F2s, and progressed very well. And I'm only speaking on my perspective. There may be some other med students who think differently, think, no, the med school didn't do whatever. But I would say, I can definitely say the med school worked their hardest to try and meet the challenges that were coming.
No, we did.
And I appreciate your openness
Yeah, no, we
talking
did.
about that.
You know, hand on heart, I'll say that. If it wasn't the case, I would say
You did your best.
we did our best, and we worked very hard, and we were actually working longer hours at the beginning of the pandemic. Because working like 7 o'clock in the evening, 8 o'clock, till we actually sat down and said, you know what, this is not the way to work. You still have to work 9 to 5, or distribute the work over a week. Don't put 3, 4, 5 meetings back to back. But as I said, we had nothing to go back as a reference to, so we just thought, you know what, let's do what we can do to the best of our ability.
I know Debbie was on holiday in Norway and came back and extended her retirement. So Dr. Mike Nelson, he was also working at the time. I think he extended his retirement even just a little bit. So yeah, no, people were working. So I guess, what would you say to the medical students who are listening? Anything you want to tell them about how you coped with those circumstances, or what efforts you try to do for them, or how you feel for them? What would you like to say to them?
I would just say to my medical students who as I said, I consider them as my colleagues, they are obviously going to be challenges as a medical student. Medicine, or studying medicine, is the longest undergraduate course anywhere in the world, 5 or 6 years off. It's probably got the most assessments in it, and you know, the expectations which are riding alongside of it, and also the responsibilities. As you become more senior, you realize that in the real world, you're out there responsible for somebody's life or limb. So all of that makes it a really difficult undergraduate course, let's put it this way. And it takes a certain type of person to rise up to those challenges. And majority of our medical students do fantastically well. You know, we all have our ups and downs. We all have our individual learning curves. I will say to all medical students that it's a marathon. It's not a 100-meter dash. Don't worry about the finish line. You will finish the finish line even if you're dressed in a chilly suit. You know, dressed as chilly, doesn't matter. You will walk at your own pace. So there's no competition. And many times in the lectures I've said to you guys that you are colleagues of future. You might be friends in future, but certainly you will be colleagues in future. So work as colleagues. Don't compete, because I started to see a lot of microaggression in terms of they got 76% and I got 65%, or they got 86%. And I said, does it really matter? You know, you graduated now. Has anybody asked you where you're from and what percentage you got as a final student? Nobody cares anymore. Nobody's ever asked me where I'm from.
I get asked, have you looked at the bloods today?
Yeah, exactly. Can you do your job? Can you do this? Are you okay to do a night or for whatever? It goes out the window. But that level of competition is not helpful.
Yeah. I want to talk about, so we did say that post the pandemic, or in the pandemic, we learned lots of things about how to teach students. And even now, when I think COVID is not rampant and there aren't as many respiratory diseases going around, but we're still having somewhat of a hybrid process, whether people in or out of the university, and then how we teach as well on online. Peer teaching has been a big culture. It's a culture. Let's say if I wanted to get interested in medical education, we've seen the growth of these companies. You've probably heard them: Geeky Medics, QuizMed, PassMedicine, and they're phenomenal. Like, I use them all the time for their OSCE videos, for revision books and stuff. So these groups are growing. And I just want to understand, what is the role of the medical school for teaching students? What is the role of peer teaching groups for us teaching ourselves? The growth of these groups, is it good? Is it bad? Are they filling a gap? Of course they're filling a gap. Is it a gap that's always been there? Or should this gap be filled by medical schools? Could you talk about that process of, you know, these larger but really useful companies and question banks being formed? Could you contextualize that for us?
Again, a good question, because with the advent of obviously with the internet, the web becoming what it is, and the social media out there, and the opportunities within social media to deliver teaching, you know, it could be like we are doing a podcast. This will be seen by so many people out there, but here we are, just 2 of us or 3 of us talking at a podcast. So the impact you can make without realizing that, you know, from this end, just through a screen, is phenomenal. It's immense. Yes, some web pages, some websites are doing phenomenal work. They're accredited. You can really depend on them. They are quality assured, quality controlled, or to a certain standard. Some aren't, you know, but that is something. There is some I can say from my end by looking at them that, you know, they're not really the best out there, but some are really, really good. You know, some do fantastically good stuff, which is absolutely fine to go and look into. I'm all for technology. I'm a technophile, is that the right word? I love technology of all sorts. But you have to be, it comes with a caveat, because what I feel now that there's an information overload on students. There's so much out there for you to go and look at. We had one book, right? Kumar and Clark, for example, or Hamilton Bailey's book, and then obviously the clinical environment where we went into. So our resources were much less. I'm talking, again, going back to when I was a medical student. So you learn from seniors. Peer teaching still existed at the time. Lots of peer teaching society. Or you learn from your clinicians, or you learn from the books, right? They weren't even, I remember first year, they weren't even PowerPoints. They were like those, have you seen those acrylic slides?
Is this smart board?
No, it wasn't smart. No, smart board is 21st century. Acetate slide. That's the acetate slide. And halfway through, the professor rubbing out something, and no, this is not right, and everybody's copying as much as we could. So we've made a huge, I think last 20-25 years, technology has gone through the roof. It has caused a lot of information overload, because students now want to learn so much from so many other places.
It's easier to make content. Yeah, but now...
But how do you know it's the right content for you? Am I learning the right thing by looking at 6 websites? You don't need 6, you just need one good accredited website, standardized. How do you know it's standardized as a medical student? You can't, because you don't have the experience yet. So you learn from seniors, or somebody might say, go and look at that particular web page or thing, or YouTube or whatever. For me, it doesn't matter where you learn it from, as long as you are safe and competent. As long as you can demonstrate that you are safe and you know the stuff, it doesn't matter where it comes from. But you have to, that is for me the key, safety and competency, isn't it? Okay. So at the end of the day, if you are who you are, you do your job competently, safely, you know when to escalate, you know when to not to cross over a certain boundary as a junior doctor, where to call for help. That's it really. Because prescribing is easy, you can just, anybody could prescribe it. If they want a medic, they will learn. If you just taught them how to do it, they learn it from the screen. But how do you learn as a professional? That's you as a medical student learning where the boundaries are. How do you escalate? How do you get involved with seniors? Who else is out there to help you? So that's the 5-year, 6-year journey as a medical student. That's why it's so important to have a much longer duration of training, because you're training for a lifestyle choice of whatever lifestyle you picked up as a medic, whether surgery or medicine, doesn't matter. But those 5-6 years are crucial. And I will say to medical students to spend more time in clinical areas and be in clinical placements. That's where you learn not just how to do stuff, but also how to interact with people, the people who will matter.
How to deal with scenarios.
Yeah, scenarios, You'll never learn how, you can read about how to manage an emergency many times from a book or see it online, and it happens in front of you.
It's different.
Yeah, it must have happened to you.
When I've dealt with my first sepsis patient, and you think of sepsis 6, but then actually doing it, or speaking to the nurses, or where to find the guidelines, because everyone has specific sepsis guidelines. That's different to a book. I may learn in a book sepsis 6, 3 in, 3 out, but it's different. Right, okay. So what's the role of the med school for then teaching? Would you say you're creating a student to be able to live the lifestyle of a doctor, and that's the difference?
That's
between,
one of the elements, isn't it? So
okay.
I think it's one is
different to, let's say, what Geeky Medics and QuizMed and PassMed.
They're great because they teach you a specific thing. So they'll teach you how to examine, let's say, a joint, for example. Fantastic, well done. You see it, you learn it, then you go and then you go and do it in the real world. You sit and ask you, or you practice it in the real world. So it's great to sort of come back and then narrow it down to a skill. But you're not just learning a skill, you're learning how to do the skill, but where to do it and how best to do it. You're also getting the knowledge behind that skill. Why am I doing this, for example? And also the professional behaviors which go with that skill. So consenting, breaking bad news, or talking to colleagues, explaining what you just did over the phone to a senior colleague. These are skills which you're learning in the real world, isn't it? So you can't learn that from let's say from a web page or from a YouTube channel. You might see 2 people conversing, fine. You learn the lingo, but then it's your turn to actually say those words out loud. How do you say them? How much confidence? Where is your knowledge? What knowledge level are you? So that's where medical school obviously is important in terms of We learn a lot of things which we tend to forget or probably will never use, as we say.
Krebs cycle,
Yeah.
for example.
Krebs cycle, but we've all learned, we still remember it at times. But I think, again, going back to medicine or medics only, I think we learn things exponentially. Our brains do expand a lot in terms of how much we learn. If you look at the content you learn over 5-6 years, it's immense. It's a lot. And then you expect it to remember it all or practice it all, which we don't, because we become specialists in certain regions. But you learn other skills. So as an undergrad, fine, you qualify as a medic, but then you start to learn to become a surgeon or a neurologist or a pediatrician or an anesthetist. And that's an entirely different skill set anyway, with a different type of knowledge, lots more knowledge. How do you do it? Because you do it because you've done 5 years of extreme hard work as a medical student. And that's the reason why you can do what you do later on as a specialist.
I think maybe when I'm asking that question, it is from a medical student perspective. It's interesting to hear your perspective, which is actually you're here to shape someone to becoming a doctor. The unique thing about the med school is, of course, you actually arrange our clinical placements, you arrange small group teaching sessions, and maybe even organize the softer side of teaching or shaping. Of course, you got these other websites which may be better at actually teaching the content or preparing us for an exam, which obviously runs through our minds a lot more. But yeah, at the end of 5 years, 6 years, you are a different person to when you are 18, 19, 20 when you arrived at medical school. And that's interesting to know. And maybe we could probably talk forever about that, but that's the soft skills that you try and create in a person. So what are the ingredients of a Sheffield Medical graduate that you and the team try and get us to be when we've qualified?
Right, I think from an individual perspective, I would say I want you guys to become colleagues right from the start. Help each other, support each other. It's not a competition. As I said, end of the day, we all graduate, we all become medics. No one after 5 years will ask you, where did you graduate from, with what were your scores, did you get a 5D or a distinction? Those things simply don't matter, but they matter now because it's very competitive, looking for the next job. But things are changing. There is a degree of competition, yes. There always will be when there are assessments. People want to do better than the next person or not. But so what if you did not do well enough? You did good enough to pass an exam. Sometimes you might just say, I'll take a pass and move on, rather than worry about why did I not get a certain number I had in my mind I should have got. So what I would say to medical students is to learn for the job. Those 5 years are learning for the job. Assessments are a hurdle you have to cross. You have to pass an exam. It is, but if you're good in the clinic, you'll pass the exam. If you're confident in the clinical environment, if you're confident otherwise, you will pass these clinical exams. I'm talking about later years. The first 2 years are all knowledge based, mostly knowledge and delivery of knowledge and absorbing it, then reproducing it, whether it's an SAQ or a different type of an exam. But yeah, it has a lot of recall as well. Initially, first 2 years, most of medical schools do work that way, but we are quite distinct. We have early as GP, where students go and see patients very much early in their career. So it's early patient contact, full body dissection, for example, anatomy at Sheffield, and also this used to be ICE and some other things where you spend some time in a clinical environment right in first year. So that's quite a unique Sheffield thing. It's happening elsewhere as well. Case-based discussions is another thing, and PBL, element of PBL. So that helps shape our medical student in Sheffield. So they're not just learning through lectures; they're learning through small groups, learning from working with peers and working with other healthcare professionals, seeing patients in the community. You must have done that community.
Yeah, in first year, you
remember that?
Paired with the family, you meet them, and you actually have to write an essay about the social side of that patient. But that's instilled of us on, I think it's like week 3, week 4, you end up going and seeing that family.
It can be quite daunting, isn't it? Suddenly,
you
think first year you come and enjoy life and just be in lectures and like others, but it doesn't work that way. So our Sheffield students are shaped in that way. I think it's really good. The other thing which we do provide at Sheffield, and we hope that you guys will do, is to see how much support is available in Sheffield Medical School. Or whether it's informal support, you can grab hold of one of us and say, hello, how are you? I need to talk with you. Or formal ways of offering support. I think it's just phenomenal, the level of support which is in existence currently in Sheffield.
It's nice, and I think a lot of students. Sheffield's one of the highest for retaining its students after
graduation.
graduation.
Must be a reason for it.
Yeah, there's a reason, of course. Yes, of course. Can we talk about your interest in music? I think people who be listening, they would know you from your Instagram live sessions. Can you tell us about where this interest came from? Where's it grown?
So, I think there is an artistic gene in our family from the maternal side, with all due respect to my father's side, because my mum was a gynecologist surgeon, but she sang, and her sisters, two of them could sing, and one could play the harmonium. My uncle could play the violin, and still does. So we had this, and my cousins could draw anybody without even looking at them, just look at you and then draw you later. So we had this sort of gene floating about, and I got the musical side of it. And I picked up instruments when I was 14, 15 and just started playing, messing around with them. So I had no formal training. I had maybe people who just sort of walked into my life at one point or the other and taught me basics or this, that, and the other. But I sort of self-trained myself to become a musician, and I thought at one point I was good enough to be a musician and not a doctor, and let's do music and not medicine. But that doesn't work in the Asian household at times. I wanted to be a cricketer at one time as well.
I want to be a cricketer as well. And then I saw a speedometer and I realized I can only bowl 60, 65. I'm like, Moeen Ali could probably bowl faster than me. He's on a 2-yard run up.
Now I played a lot of cricket. I was sort of digressing to cricket, but I played cricket for my university, my clubs. In Karachi, played a lot of street cricket as well. So me and my brother, who's now a radiologist in London, we were pretty decent cricketers, to the point where my mum was thinking that these guys are not studying hard enough, and she said, let's ban cricket. And I said, if you ban cricket, I'll stop studying medicine. And there was a little argument over dinner time, like used to happen. It does happen at Asian dinner times. That's where all the controversies come out. But very quickly she realized that, mum, if I don't study hard enough, I won't play, and and vice versa. So that was my sort of cricketing career in a nutshell. But music has always been with me, so I never let go of it. For me, it was a great de-stress at the end of the day, still is. And I've played with, I'm blessed with friends in the music industry, both in Pakistan and here. Artists from those times, 90s, and when we were all young and listening to Pakistani music, late 80s, 90s, and 2000s. And for me, it was like I go there and I'm just Amir or Amir, and I'm playing with them or sitting with them. It's not no Dr Burney, it's not Mr Burney. It's just I'm one of the guys, and suddenly just talking music and nothing about medicine, nothing about the daily grind. For me, it's a great de-stressor. So was sports. And music carried on, and it's become more and more now because I can do it individually, play the piano. And during COVID, I did a lot of during COVID I started doing these live sessions actually on Instagram, because
that's where they started.
And I'll tell you how it actually started. My friend was deathly scared of COVID. She and her husband thought they'll get it. They're not medics, and they were very, very worried. So they called me, asking me a few questions, and I said, you know what, let's not talk about this. What are you doing tonight? And she said, well, obviously we're all in a lockdown, nothing much. I said, okay, fine. Tonight, what I will do after dinner, we'll go on WhatsApp live.
Yeah, that's how it started. I think that's how I started watching it. Now you do with other people, as in I think come to your house or you go to their house.
Yeah.
Sorry, I don't want to interrupt.
No,
but
it's
yes.
interesting. Now I'm going back to those COVID times.
Yeah,
memories
I saw
of
like Zoom or was it WhatsApp?
Yeah, so it started as a WhatsApp conversation.
Right.
This is the absolute first one. And I said, okay, fine. After dinner, you guys just relax. I'll play some music for you. So she liked ABBA and her husband. So I just played ABBA songs for 2 hours for them. So all those ABBA songs, Chiquitita and whatever, Dancing Queen. And that gave me an idea. You know what? This is fantastic stuff. Not just for them, but for me as well, because I got distracted. I'm not worried about tomorrow or what's going to happen to me or my friends who are not well or unwell and my family members across the world. I just sort of zoned out for 2 hours. And I started doing them on a weekly basis in Nottingham, where I was at the time. And then a name came out of somewhere. A friend of mine said, why don't you call them the MTC show, the Music Teen Company, in conversation with Amir Burney. So we called it the MTC show and started making posters and advertising them in Nottingham. And then Zoom was being used. So we started saying, all right, here's the link. Anybody interested, doesn't matter who you are, join in. And then at one point, we had 80, 90 families just on Zoom and listening to me playing. And then I found 2 more colleagues of mine who were medics, very good, skillful musicians and singers. And they were playing the guitars or singing. And we had this community of people just sort of engaging on a weekend, usually Friday night, could be a weeknight because we were on a lockdown, and they were pretty long sessions, 2 hours, 3 hours. At the end, my fingers were all swollen up, but I loved doing it. And that now led to the fact that I'm doing regular Instagram live sessions promoting British Pakistani artists or Pakistani artists.
That's very nice. That's very...
It started in COVID time, so that's another thing you can, in a way say if the pandemic didn't happen, this probably wouldn't have happened as well.
But still continued on, and you've talked about how music can be used as a calming way to play, but then also to listen to. I think people hear about listening to music to being very calming, but you found it very calming and soothing. Did you find it calming, soothing because you're playing music, because it's taking something off your mind, or because you were helping someone else? How did you feel? Or
I think now I can say it helped a lot of people, including myself, but it was never the intention to I'm helping people. It's all about just do something together, let's get our minds off and enjoy, because to be honest, I did not know what might happen tomorrow. Could have got COVID. There was no vaccines at the time. It was just like a death sentence in a way. People thought they get COVID, they won't make it. And certain age and certain risk factors thrown in, then suddenly the risk or the chance of dying were higher. So you had to block it out somehow. So we did it, and very proud of my friends who were part of it, who actually played 3 hours, 4 hours with me online. And they're all medics, the singers, and there's some really good people out there. Amjad Iqbal and Waqar Hussain, Salman Shahid, and all those names because they were all part of it. Yeah. And then we started getting people from Pakistan and Middle East, Australia, America coming into those sessions. We did a joint session with my friends in Houston. So they had their friends sat listening, watching, and my friends sat listening, watching. So can you imagine Houston, Karachi?
That's
Houston. We have
got this international concert.
It was just brilliant stuff, and we were learning it how to do music online.
Were you collaborating with people? How would you do that? Because especially if people have bad Wi-Fi, how would you sync in?
So America obviously had good Wi-Fi. We had good Wi-Fi. The problem was when we were abroad, for example. Yeah. So what we learned again in December 2021. No, December 2020. We had the peak of lockdown, weren't we?
Yes, we were.
So there was a band called Raga Boys in Lahore, and they were in touch with me, good friends, and we said, let's do a New Year night celebration. We are all in lockdown. We have to have something. So I organized for them. Pakistan didn't have massive lockdowns. They had regional lockdowns. So they were able to do a show at some place. What they did was they were just them on the stage with their band, and they I think we did Facebook Live, and that's what we used, and we had 80 families here in Derby, Nottingham, and elsewhere just enjoying a New Year night celebration in their home. So they started at 2 o'clock Pakistan time, which was 10 o'clock I think, or 9 o'clock our time, and they played for 3 hours, and they finished at 12 midnight UK time, which was 5 o'clock in Pakistan. And that was the first concert I did. I paid for them. I paid everything and all the services, and we bought Wi-Fi. So we bought better internet service delivery to do that program. So I think I did 4 shows during the COVID lockdown with 4 Pakistani artists to support Pakistani artists as well, because it was all shut down. They weren't making any money, especially the artists who were playing on a weekly basis and making some money at the end of the week. So again, it wasn't with the intention to help them. It just sort of became a channel of helping people.
On the music interest, I went to one of your events. It was in Stockport.
So you came to Stockport, the Lighthouse Cinema, was it?
Yes, and that was a charitable event. It was absolutely amazing. And whilst in your day-to-day job, you're a medical educator, but even in your free time, you've already talked about it, but you have other interests where you're arranging events through your interest in music. Could you just talk about the other work that you do, whether it's music or not music, and what sort of impact that kind of work is having here and also back in Pakistan?
So I think, yes, you brought it up. So with music events, I've always tried to promote not just British Pakistani artists, but any artist really, because I love music or art of any sort. But more and more, yes, we just started thinking of promoting British Pakistani artists and Pakistani artists post-pandemic. And you came to the show, which was Ahmed Jhanzeb from Pakistan, and whatever money we made from our events, we've always given it to charity.
And the Leo twins.
Yes, and the Leo twins were there.
I'm following them now. I listen to their all or their violinist work is.
For those who do not know the Leo twins, they are obviously twin brothers from Lahore, and now they settled in the UK. And they're immense musicians, and they can play multiple instruments. Coke Studio, Nescafe Basements. That's where I first saw them. And all the good friends, and they perform at our events. So music, yes, it's sort of. I think there was a natural progress of things that from playing individually, playing with friends, I started doing events as well. So I've done a few events in Nottingham, London, Manchester now, and always enjoyed watching people enjoying themselves. So when you are an organizer, it's like chaos backstage,
I see you guys running around. Yeah.
Then you see people having a great time. For me, that's the real high of the day, and people enjoying and whatever. And then we do an after party, which is again just to relax. But it's all to promote people from
there's Pakistani artists,
British Pakistani artists, and others, even Indian artists.
When did that start for you? When did you start doing those events, or when did you feel like I wanted to support Pakistani artists?
Good question. The when is a tricky one.
When and why?
Why? Because of the love for it. So it's quite easy, and the fact that we had connection. Always.
No, but you've always had an interest in music. When did you decide?
Individually, I probably 2017, 18, when I started to think I couldn't do those things. I did my first major event in Nottingham, because Nottingham was a small city, it was a small community, and we just thought, let's do some, let's do events in Nottingham. Let's do sporting events, music events, things like those. Found some like-minded people to work with, and that's how it all started more formally. But before that, I was part of the Dow Medical College where I studied. There is an alumni association called DOGANE. So DOGANE was part of that Ahmad Jazeb show as well. And I've always been part of them since 2004. Okay. So they do a yearly social academic event. There's music. So I learned how to organize things, working with them as well, and then individually later. So music will always be part of it, whether it's my individual work or events. The other work which I started to do was charitable work, working with charities, and why not? At some point, I think we should always give back to the communities we are either living in or brought up in. I grew up in London as a kid, went to Pakistan, came back. So for me, London and Karachi were two cities in my life, always have been. And you should always give back to the communities where you are, whether it's Pakistan or Britain. So the work, I'll talk about that in a bit, but I just wanted to talk about something which we did was to form an organization called Association of Pakistani Physicians of Northern Europe, APPNE. Again, I saw my seniors talk about it, and there was an organization called UPNA in America, APPNA, which has been in existence for more than 30 years. So this is something which senior medics in
the group you're part of is Northern Europe.
Is Northern Europe, APPNE. So the word play is in English as APPNE, but Urdu is Apne. So Apne as in our people, So that's the word play we thought of, very clever for a few medics, isn't it? So Apna and Apne are sister organizations in that sense. So we learned a lot from them, and then Apne was formed on the back of from some of our senior medics in this country who talked about forming an organization, bringing people together, providing a platform, educational, social, or academic, and then the real important bit was there's going to be a democratic organization, elections every 2 years or 3 years, and I ran for president and became the first president for the organization between 2019 and 2021, and had that COVID pandemic in the middle of it while running an organization which we did some real good work. Now I can talk about it. So that's something which I did. I learned a lot how to work with people, seniors, juniors, from an organizational point of view, and we reached out to governments in Pakistan here as well, and made friends across the world, really, again through technology, Zoom and whatnot. We got to meet friends we could have not met otherwise, because it's physically impossible to travel to Australia, and at times not impossible, but given the times, we were just engaging online through meetings on Zoom and other social media platforms. And thankfully we are now, from last I heard, we are now 2,000 members strong, healthcare professionals, one of the largest organizations of British physicians, not just British but European Pakistani physicians of Pakistani descent, and phenomenal work is being done. We just had our event in Birmingham on the 14th of October. Huge event.
What's the objective then of UPNI?
Apne's objective to me, the vision was first to bring people together, give a platform to raise awareness about issues affecting us, and also to do educational and academic work together, learn from each other's experience and expertise, provide a platform for junior doctors to approach us. We talked about approachability. 25, 30 years ago, you were working. If you came from abroad and started working, you were on your own. Really, there wasn't much. Who's here to help me? And now we have channels for just drop an email to Apne and they will be somebody.
I see the odd message on the group chat where there's jobs, career, even just housing and where to live. Yeah, there are those messages.
So is this social network or the social fabric around providing? This didn't exist. I'll be very honest. 30, 40 years ago.
No, unless you know someone.
Unless you knew an uncle or an aunt in the system.
But it just makes it easier now.
It's this, you can just drop. So this is where Apne comes in. As a very handy organization. There are others as well. It's not just Apne, but there's other organizations doing some really good work. So I'm very political in my approach to life, and I always thought we need to raise things which are political as well. Yeah. So which are affecting us medics. We're not united as a medical fraternity at times, and certainly we should come together and raise issues which are affecting us at the right level to the right people.
Yeah, and you were mentioning that earlier, that you're, as well as supporting those in Pakistan and the UK, but in the UK promoting British doctors, British Pakistani values, and you said you've been doing some government work as well, or your way of lobbying in some sort of way.
Yeah, we did work with them right through the pandemic, so we raised issues around the lack of protective equipment, for example, initially PPE, and also the impact of COVID on the BAME communities. A lot of our friends and colleagues who passed away initially, they belonged to the BAME community or the ethnic minorities. And why was that happening? So Apne became part of all of those questions as well. And yes, and we did raise a lot of questions with the British government all the way through, and learn from them, and as well as from our colleagues in Pakistan, because Pakistan somehow was not as affected by COVID, although lots of people did pass away there, but they did some really smart lockdowns in Pakistan. So we learned a lot from them as well. How are they working, and what's working for them. But if you look around Pakistan, a lot of people died in other countries as well. So something obviously was working for them. So it wasn't just learning, just saying we are the best in the world, or we know the most, because you come from the UK. Is also what we have learned from other countries and other people across. By being part of an organization like this, you get an opportunity to work with people who are as experienced than you are, or maybe more experienced, and they teach you a lot. So that, I think I've been really blessed in that sense, learning from individuals across the world, both junior and seniors.
You founded the group during the pandemic, is that right? No, it's a founder before.
No, this actually was this was a group which was in the making much before the pandemic. Yeah. But I heard from my seniors, Dr. Shahid Qureshi is my senior from Dr Medical College. He was the first one I heard mention the word APPNE or Apne, and he was probably the main person behind at the time. But then our seniors got together, then we got together with other medical schools and not medical schools, other alumni from different schools across Pakistan, and formed a steering group which worked for 2 years to lay down the foundation of this organization. And then it was formally launched in 2018, and then the first elections happened in 2018 December.
Right. I've noticed, of course, in my background, with same Pakistani background, of course, I was born in the UK. There's always this sense of charity or helping others, and I think I could probably even broaden that out to ethnic groups, that they seem to support, their people in the UK as well as back in their home countries. And you're involved in a number of charities, as you said, Upney, you've got DOGANE, you've got FAMS, which all do very different roles but very similar, which is supporting British Muslims as well as Pakistani Muslims. Where does that value come from? Could you talk about maybe in your sense, where does that value come from you? Is it religion? Is it culture? Is it parents' upbringing? Where does that come? And I guess, why do you do it? Why does that get you ticking or going every day?
Okay, that's a good question. Now, I think it triggered, there was a conversation I had with someone at a party, right? So I'm talking 20, maybe 15 years ago. You're young, you're working as a surgeon in Pakistan, even here, you have your own career in front of you. You're not really looking too much behind, other than your own lifestyle, your own day to day. And I was doing some work, and I went to this dinner party, and somebody introduced me to a senior who wasn't a medic actually. And he said, in Urdu, they said, oh, this is Dr. Burney. He does a lot of work, blah, blah, blah. And he said, oh, I heard you do a lot of work. What work have you really done? If you were to die tomorrow, what's your legacy? I said, what? I just met you. This is a pretty serious question. But, that was a real trigger, saying, yeah, I do this, I do that, I do bits and bobs else, wherever. But what work have I really done? And I say, okay, that's a good question. I don't have an answer to it. But I do stuff, I do this, and he was really impressed. I was pretending not to be. And then a friend of mine, who was my senior, Dr. Abdul Bari Khan, he is the president. He was the CEO of Indus Hospitals in Pakistan. I'm one of their ambassadors now in the UK. And he called me and he said, you are doing an event for us in Nottingham. Literally, I said, when? And he said, it's 5 weeks' time. I said, what, 5 weeks' time? That's not enough time. I said, yeah, it's fine. Enough time for you guys to do whatever. And that's the first major event I did as a charity, 2019, I think. So I was doing little charity events, small events, 30, 40 people getting together, raising some money, giving it to a local charity. We did an event in 2018 for well-being of women, raised some money for it, had a Pakistani artist sing for us, and give the money to well-being of women. But nothing big scale, nothing like a lifestyle of working for charities. So Indus Hospital is one which triggered me into doing more work, and the other one is Midland Doctors in Kashmir. So again, the CEO is one of my dearest friends, Dr. Yusuf Tahar. So I saw them doing this work. So they were all very busy surgeons, and so the hospital in Midland Doctors was formed after the earthquake in Pakistan, in Kashmir, Muzaffarabad. Yeah. So we've been there, we supported. And I just saw them, if they have the time to do what they're doing, surely I'll find time. And I had my networks. I was doing a lot of other things as well. So they probably realized that I could be of use to them because of my networks and connections. Yes. Yeah. So it worked both ways. But it's fantastic now. I just love that. Right. And it's very addictive as well when you are trying to help people and you can see something happening. So you make a little donation here, then you go and visit a massive trauma center or a massive hospital in Karachi, Pakistan. You see, and there's a little contribution from somebody in the UK as well to it. Right. So it's quite it's very rewarding in that sense to help people. It comes from our religion as well.
Is there a religious element to it when the need to help people?
Well, we have to give zakat, as a practicing Muslim, but that's something you do and you forget and you move on. But on a day-to-day basis to help people, not everyone does it, not everybody can do it because of time and other responsibilities. But those people who do it, my hats off to them, to finding the time to do that, which I do now, but I just do it. Right. But now it's second nature.
Yeah, zakah, for those who are listening, is you got 5 pillars of Islam. One of them is to give money to charity. That's at minimum that a Muslim should do. But of course, you continue to do beyond and further from that. I want to finish off with 2 questions. So one is a personal advice, if that's okay. I'm just going to be honest. At times I feel, with the various things that I'm doing, and I think maybe other young people, young professionals feel this is, you did kind of talk about it, is I feel maybe selfish at times that most of the time that I have, I end up giving it to myself. Right now, I'm in F1. I'm thinking about core surgical training, and I'm thinking about the tick box things that I need to do, audits, publications, research, teaching, or whatever. But it's all for me to progress in my training. Now, of course, I know you're going to come back and say, you're a doctor and you did various things on MedSoc and you are giving to people, and that's fine. But I feel a lot of my days is I'm working on a skill or project or building a talent or something to build on me so that I'm better. But then there's always a little bit in the back of my head that I'm selfish because I've asked my family to give me time to work on my own thing. I see the way you live your life now is you're always giving. You're a medical educator 9 to 5, and then also you're part of other various charities. Firstly, am I characterizing myself correct or well? How would you say if a young person's feeling like I am, is that fine? Is that fine to maybe be working on yourself? or how do you balance that relationship? Because obviously I'm still young, I haven't got that foundation. You would have that foundation. How do I balance that, or how others would balance that?
So my advice to you or anybody in your position at this stage of your career, because you're just stepping onto the career ladder,
I am.
is to focus on the career.
Okay.
Because that's the skill you have to develop over the next 5, 7, 8 years. So did you mention surgery? So if you're going to be a surgeon, you need to have that in your kitty to become a very good surgeon. You need to develop a skill set, and most of your time will be given to learning, procuring knowledge and learning the skills required to be a good surgeon. So your utmost focus will be, or should be, your career pathway at this point in time.
And that's fine.
That is absolutely fine. You might have little pockets of times where you might want to do something, whether it's political or social or charitable. That's absolutely fine. But be careful, because these are very time-consuming things as well. And you only have one mind, one body, for example. You have to still look after yourself. Your own physical health and well-being is extremely important, especially now post-pandemic. I was probably guilty of not looking after myself physically. Became unwell during some of the work I do. But you think your doctor, you're hard nuts to crack, and you crack or move on. But really shouldn't be the case. You have to look after yourself as well. It's quite important. So for you, would be to focus on the career first. Once you are well established in your career, because by nature you will go back to those things. I've seen you progress as a student. You're very political. You do a lot of work, MedSoc and volunteer work. So I know somebody of your personality type will probably go back to charity, politics. Some other stuff will happen. If not now, 10, 15, 20 years time, it won't be surprising if I see you, I won't say which political party or wherever you are, but in politics or in charity or in social work. Because you can see a certain type of personality. But if somebody wants to focus on the career and be a fantastic medic, absolutely fine. They want to focus on a career and play sports alongside of it, provided they can do, absolutely fine. Or they want to focus on themselves and their family and a career, is absolutely fine. It's a lifestyle choice, really, isn't it? There's no compulsion to be somebody or to copy somebody or to be like somebody. You can be inspired by somebody. I got motivation by looking at some other individuals, the two I mentioned, Bari Bhai, as I call them, or Ifti Bhai. They're both brothers, Bhai's brothers in Urdu. I saw them do the work. But if I hadn't seen them, maybe I wouldn't have done the work. I probably would like to do the work, but how do I do it? So and I think medical education gave me the chance to do it, because by being a full-time educator, I got time to do other things as well, because you're not on call and you're not in the hospital system, and I got that opportunity to do so. So you never know where the next opportunity lies in your life. Seriously, you don't know which door you knock on, what door will open your life, what happens after you open that door, and what's lying on the other side of. So for me, I would never say to anybody, look at my career path and follow my lifestyle, because it's not.
Am I right to have feelings of selfishness when and others are working on themselves, as you say now, focusing on becoming a surgeon, GP, or whatever, even a non-medicine? That's a okay feeling. But how do you balance that with, but I would like to kind of help people, or even if I don't want to do like a big, huge charity project, but you want to help those around you, your family at least, and so how do you manage that?
Yeah, that's a difficult one, isn't it? Now, if your family my family was mostly medics, so we understood how the lifestyle works. Okay. My father wasn't, but he was always very, very appreciative of what we did, and one of my brothers wasn't, but the rest of us were mostly medics. So even dinner time conversations would be around medicine and hospital running day to day. And my father,
anatomy revision on the table.
How's your medical school life going, and how was the last exam? I remember those conversations, but my father was very, very supportive of it and appreciative of the fact as well. So when your partner or your wife, husband, or whoever so is in your life is not a medic, it's difficult for them to understand how extreme this lifestyle can be. You're spending more time in the hospital than you spend with the family. Look at it technically. So, you go and sleep for 6-7 hours, but the rest of the time you're spending in your workplace, which is true for most professions nowadays. How do you balance it with your family is I have no answer to. Seriously, there's no right or wrong answer to it. It needs everybody in the family to find time for each other somehow, and then make the best of that time.
Everyone who will be listening will see that your 9 to 5 you're helping people, your evening and weekends you're helping people in your charitable work. Can you tell us how proud you feel by having a hard work ethic, and also how proud you feel when you do help people here or in Pakistan or anywhere?
Yeah, rather than saying proud, it's this sense of it's just this sense of doing something good for somebody, and then you get this real nice feeling of, yeah, you made a change, or you made a little change somewhere in somebody's life by doing something good for them. And yes, for me, it's the joy comes from when other people appreciate it. So when people turn around or say, when I'm not even in the room and they mention my name or say something about the work I do, that's the real joy of it. Or when I was a practicing surgeon, the joy of patients coming to me and saying, thank you for what you did. Just a little thank you was so important to us. I feel extremely proud of the people I work with, the people I've learned of in charity, social work, and others, and even in medical education. It's just this fantastic feeling of where you can. I think we are socially accountable as professionals. We learn so much, we can do so much, and doctors can learn new skills. This is something I've learned. I can't say about other professions, but certainly as a medic, you can learn a new skill. You can learn a whole new language. I've seen doctors do it. I've not seen many other professional friends of mine do that. So, and a lot of doctors do politics, and they do music, and do sports, and learn languages, and maybe it's just the nature of those 5-6 years, the grueling times you put in, and then the 6-7 years you put in training. It just shapes you as an individual. So I'm really proud of the people I've worked with, and very happy that I'm making a small change somewhere.
Ms. Burney, I really appreciate your openness, talking about your experiences at the medical school and the work ethic of yourself, the charity work that you do. And I think a lot of people will be listening today will be learning about how to shape their lives to see that giving to people not just helps others, but can also help you to live a happier and healthier life. I appreciate talking to you, and I look forward to the next event.
Indeed,
that you do invite me
you're
for.
all invited. Amna, thank you as well. And yourself and your family, I've had the pleasure of meeting them many times, and they are a lovely group of people, so always welcome. One thing I will say, I've learned this, I saw this quote somewhere. No, actually I heard someone say, when God, Allah subhanahu wa ta'ala in our case, gives you his blessings, and you are in a position where you can raise your standard of living, you must raise your standard of giving as well. Right. And that is it. So if and I always say, if you have 10 rupees, give me 1. If you have 1,000, give me 10. You don't have to give me 1,000 rupees or 1,000 pounds. Give me 1 pound. And at one of the events, a girl came. She was only about 8 or 9, and I had a little tap on my shoulder. So I turned around. She was stood there, and I'll show you that photograph one day. And she said, "Oh, I heard you do some charity work, and I have to give you something out of my pocket money." So okay, fine. And she gave me £1, like a coin, because she got £5 a week or something like that. And I said, "Fantastic! This is probably the most precious." To her, and she gave it to me. It's so dear to me, and I have a photograph, and I've used that with her parents' permissions to promote how giving doesn't start with extremely large amounts of money. It could be your time could be your giving. You go and help people, volunteer in a camp. So the giving could be anything. So it doesn't have to be hundreds and hundreds of pounds or rupees or whatever. It could be just your 2 hours at a camp somewhere.
That's very sweet.
Right.
Thank you, Mr. Burney.
Yes, thank you very much.
Thank you. I'd like to end with a quote from the founder of Pakistan, Muhammad Ali Jinnah. With faith, discipline, and selfless devotion to duty, there is nothing worthwhile that you cannot achieve. Thank you for listening to the Second Opinion podcast. Please like and subscribe if you enjoyed listening, and check out our other channels. See you next time.